Now, live from Whitney Media, 1460 WVOX, the Greenburgh Report with Greenburgh Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenburgh Town Supervisor Paul Feiner.
Good morning. My name's Paul Feiner.
I'm David Bach.
And if you're a parent and your child has some issues and behavioral symptoms, it sometimes could be stressful, or it's always stressful. Today with us is Matthew Marzella, and he's a parent. He resides in Hartsdale, and he's been active with an organization that is trying to educate people about a childhood autoimmune disease order called PANDAS. And Matt, could you maybe just start by telling us a little bit about yourself and your experiences?
First of all, Paul, thanks for having me, giving this opportunity to raise awareness on this autoimmune disorder. It's called PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. And another term that people have heard is called PANDAS, which is a subset of PANS, which is Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal. So how I came about, me and my wife came about this disorder was one day in 2016. It was November 5th, 2016. Our daughter, who was 5 at the time, going to turn 6, she woke up a different person. Went to bed one night normal, woke up with OCD issues, separation anxiety issues, intrusive thoughts that something was going to happen or that there was a contamination. And we went to our pediatrician locally and told the doctor about the symptoms and just kind of deferred us to a psychologist or a psychiatrist. And we're like, okay, symptoms got a little worse over the next week, increasing with the OCD, hand washing, things like that, which she had never done before. We started noticing some new symptoms within that week. Sensory issues, didn't like the way clothes felt all of a sudden. Never had these issues before. Intrusive thoughts started to get a lot worse about things being contaminated. So we went back to the doctor, said, we started doing some research. What type of disorder gives you OCD overnight? It's not something that seems to come up overnight. People kind of develop it over years. So we came across this PANDAS, and we brought it to the doctor's attention, and the doctor said it's very rare, so it's probably not that. And in my thinking, it's like, well, just because something's rare, why can't this child have it? Someone's got to have it, even if it's rare. Someone wins the lottery, even though it's rare to win. So we kind of waited a few more days, did more research, noticed there was some preliminary blood tests that could be run to maybe rule out an infection, because what PANS and PANDAS, it's usually an infectious trigger that's causing these neuropsychiatric symptoms. So we went to the doctor again and said, can you run these blood tests? And the doctor said, in an email, we were talking to the doctor through an email, there's no need to run any blood work at this time. And we're trying to tell the doctor there's something not right with our child. This is someone who was so independent, able to do everything for herself, and all of a sudden couldn't. Now we're getting closer to Thanksgiving, and things are just getting worse. We talked to, I talked to my wife. I said, let's just go to the doctor. We'll present the research we found and ask to just run this blood test, because we were at a loss. Like, we didn't have our child. And we went to the doctor. Finally, she said, fine, I'll run the blood tests. Blood test came back, and she had elevated levels of strep throat, but no strep throat symptoms, elevated levels of mycoplasma, which causes pneumonia. So she said, all right, well, since her levels are elevated, I'll give you a 5-day course of antibiotics. If the symptoms start to go away, you'll make me a believer. So this is kind of like what we're fighting with, that the doctors aren't really familiar with this, and they say it's rare, but I think it's more that they're just unfamiliar with it, because there are plenty of doctors spread out throughout the country that are familiar with it, that are helping our children. So after about 1 day on the antibiotic, the symptoms started to decrease. Right before Thanksgiving, before she had the antibiotics, we couldn't touch her. She couldn't give anybody a kiss, like for fear of like contamination. And within one day, she was able to start to touch people again and give a kiss or whatever.
Is she right now doing good?
Right now she's doing great. So we kept pursuing this, trying to find a doctor that can help us. And we eventually found a doctor in New Jersey who's been studying this for 20 years.
And we have to take a break now, and we'll be back in about 5 minutes, and we'll talk more about PANDAS, and the New England Association that deals with these issues. We'll also discuss how you could, what you should know, and various symptoms. I'm Paul Feiner, Greenburgh Town Supervisor. That's good.
Now, back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, my name's Paul Feiner, and I'm the Greenburgh Town Supervisor.
And I'm David Bach.
And we have a very interesting program that could actually help families with children who have various behavioral symptoms. My guest is Matthew Marzella, who lives in Hartsdale, a parent of a child who has been treated really successfully with childhood autoimmune disorder, PANDAS, SPAMS, and it's often misdiagnosed. Matt, could you maybe tell us what some of the symptoms are?
Oh, yes. So just to clarify, too, that I'm not a doctor, just a parent, so I'm only explaining what I've learned along the way over the past year and a half, which is quite a bit. But things that parents want to look out for are symptoms such as a sudden onset of anxiety or separation anxiety, especially after an infection, emotional liability, depression, irritability, aggression, developmental and behavioral regression, and a deterioration in school performance is a big one. If parents start seeing the child's handwriting all of a sudden change and get really bad, or their math skills start to become really bad, that's a big symptom too. Sensory and motor issues. And
why would math skills?
I don't know why it's math, but that's one of the symptoms is a deterioration in math skills, forgetting how to do the calculations, I guess, or the brain not being able to do the calculations. It's quite interesting. But sleep disturbances, wetting the bed, and tics, motor tics, verbal tics. If these are appearing out of nowhere with no other known cause, it may be something to look into and find a doctor that could help. The problem is there's not many doctors around here.
Do any children get it when they're older than 13?
Yes, I think some kids can have an onset that late, yes. It's usually between ages 4 to 7 from what I'm aware of, but some children it can happen later.
And your daughter's been cured. How old is she now?
I wouldn't say cured, but she's 7 now, and I guess it's like in remission almost. Like we have it under control for the most part. I mean, we're under the care of a doctor in Long Island right now who's been treating some various things for her. The doctor that we started with is Dr. Trifoletti in New Jersey, who's going to be calling in, and he can really explain what this misdirected immune response is.
Now, since I've known you, it seems like the establishment medical profession doesn't take this as seriously as they should. Is that accurate?
That's what a lot of people are facing. It's not taken seriously. We've dealt with it back in November 2016, where we were told that just go see the psychiatrist, and we were already seeing one at the time anyway. And what happens is a lot of children will go to the psychiatrist and they'll be put on psychiatric medication to control these OCD behaviors and intrusive thoughts, and it just makes the kids worse. And
why does some of the medications make things worse?
I I'm not exactly sure about that. It might be something we can ask Dr. Trifoletti, but from my understanding is that those are just treating the symptoms. And these doctors that are treating PANS and PANDAS are treating what's causing the symptoms, treating the infectious triggers or treating the allergies, because that's what's giving this incorrect immune response, and that's going to the brain and creating this OCD, anxiety, and loss of school skills, things like that.
Does your child take medication?
Yeah, she's on some supplements and some antibiotics for the infection she has.
So
is this? There's no like underlying single virus for PANS or PANDAS. It's kind of like a mix of viruses that don't react right.
I wouldn't say it's that. It's, from my understanding, that these children have an immune system that is not working properly. Something has damaged it. They're not sure what, but most of us are, let's say when we get a vaccine, there's extra stuff in the vaccine that our bodies are able to clear out. No problem, we're fine. With these kids, sometimes their bodies can't clear those extra toxins out. Their immune system can't get rid of it. So it kind of overloads their immune system, where now you have like this perfect storm, and then when they get these infections, their bodies can't clear them. Then there's something called the blood-brain barrier, where the antibodies are able, that are go and fight these infections, are able to pass through this blood-brain barrier and get into the child's brain, and it's attacking this part of the brain that's causing these issues. And I think the doctor can explain a lot more of that.
That is great. What type of outreach have you done? I know you had a meeting at the Greenburgh Library that was well attended.
So there's a movie out there, a documentary called My Kid Is Not Crazy, about all the misdiagnosis that these families are facing, these children are facing with these doctors that are misdiagnosing them with Tourette's or just the OCD or separation anxiety, and not really getting to the heart of the problem. So we did a screening back in April at the Greenburgh Town Library. We had about 30 people come out. A lot of people come out and ask questions. And then right now we're trying to do some more screenings. We just did one in White Plains at the Ethical Society a couple weeks ago.
And was it well attended?
It was about the same, about 30 different people. There was a couple of parents there that had suspicions about their child, so I think they're going to get on a path now to get some help. There's an advocacy group that is talking with people in Albany to get this covered by insurance. Right now it's on their radar. It's recognized by the state, and the next step is to get insurance coverage, because this is a very expensive disorder to treat, and a lot of families can't afford it.
Well, how expensive has it been for you?
Thousands.
So it's very stressful.
Yes.
Do you think you're getting close to getting the state to help you with insurance issues?
I think they are. Illinois was the first state to recognize it and mandate insurance coverage. So I think once that started, I think there's just going to be a domino effect that these other states jump on. But there are people that are working on that. I'm not totally part of that group. But I think since Illinois did, I think it's only a matter of time before the rest of the states really jump on. We
have to take on another break. I'm Paul Feiner, a Greenburgh Town Supervisor, and there's a website, www.nepans.org, if you want more further information. Thank you. We'll be right back.
WVOX. There's always something happening at 1460 on your radio.
1460 WVOX.
Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, my name's Paul Feiner. I'm the Greenburgh Supervisor.
I'm David Bach.
And we're learning about a symptom that some children have. It's behavioral with physical symptoms, academic symptoms, and it's often misdiagnosed. And my guest is Matthew Marzella, a resident of Hartsdale, whose child is being treated by the disorder. And we have a phone call. Good morning.
Yes, hello. This is Dr. Trifoletti.
I'm the doctor that has treated the child.
Hi, Dr. Trifoletti. It's Matt Marzella.
Yeah, how are you doing? Oh, hi, Matt.
Thanks for calling in. I was telling them how great you are and how you're really helping these children with this disorder where we're having trouble finding help for it.
Could you tell us why this is such a difficult, problem to diagnose?
Yeah, it's relatively common, and it involves, a sudden change of behavior of a child, and it can be a wide range of symptoms. It's often OCD and anxiety, more like the type of symptoms that, and tics as well, some of the symptoms that Megan had. But it can be a range of other symptoms, but it can be very frightening because suddenly you can have a child one morning is fine, and then later in the day is a completely different child, So it's something that there is increasing awareness. I think most child psychiatrists, especially those in Westchester, know about this and know to look for it. But it can look very much like a psychiatric illness, almost like a child snaps. And unfortunately, some of them do end up in psychiatric facilities, and when a simple treatment of this condition would avoid that.
What type of treatment do you give?
Well, it depends on what they have. Generally, early on in the condition, even something simple like Motrin, ibuprofen, works very well in treating this condition. And depending on the infection that is triggering it, there might be different antibiotics or sometimes antiviral medicines. But all very simple things that often the child has already taken in the past for ear infections. And one thing that usually doesn't work well here are the usual psychiatric medications, which, depending on the symptoms, might be things such as Prozac family medicines. We certainly don't want to put a young child on those meds if at all possible, in extreme situations. And very often they will respond to the simpler treatments. Once this goes on longer, there may be other treatments needed for it sort of turns into an autoimmune disease, and there are other things that need to be done for that. But for the most part, by recognizing it, defining what the trigger is, you can stabilize the child without having to resort to stronger medications.
Could this be treated without any medication?
If you did nothing, it probably would resolve by itself. It would take weeks, months to do that, though, usually. And usually the symptoms are such that parents can't tolerate that because the child either may be extremely aggressive or violent or failing in school, or usually something is needed to help it along, and because of the nature of the symptoms. If it's just tics, motor tics, sometimes that can be tolerated, and they will go. The nature of this is a little bit like asthma. It waxes and wanes, so it'll go away, but then it may come back again. And my typical time it comes back is right when kids are going back to school. So it's a little better in the summer, so you may not see as many cases, but typically September, October, it shoots up again, and we see more episodes of it.
Right. What are some of the academic symptoms?
Well, one off the bat is school phobia. A lot of times, due to separation anxiety, a child will just simply, who loved school previously, suddenly doesn't want to go to school, and that can be a problem. In addition, they may have specific fears about the school. For example, a common thing is something called fear of vomiting, which is fancy name is emetophobia. And there they may have seen somebody vomit in the lunchroom or something, and then that generalizes to total anxiety, and they don't want to go to school. The other things is that if they make it to school, there can be some cognitive problems. Sometimes it's related to intrusive thoughts that they have, which prevent them from focusing, and there are also things where their actual motor skills can degrade, so that their handwriting will go down. So a lot of it has to do with things like dyslexia, we call dyslexia, poor problems with reading, dysgraphia, which is problems with writing, math problem issues, and these can happen suddenly and uncharacteristically in an otherwise good student. And in the context of all the other symptoms, it really frightens parents to think that something very, something like a brain tumor or something like that is going on, which is almost never the case. There are other symptoms for that.
Well, it's a very nerve-wracking, problem. You mentioned, Matt mentioned that currently insurance doesn't cover the coverage. Are you optimistic that that's going to change soon?
Yes, we are. Are certain states, Illinois is one of them, that have begun to cover this fully. New York State has recently, this was several years ago now, Governor Cuomo proclaimed this as made a proclamation to proclaim this as a valid illness that requires further study, etc. And I think that a lot of it is pressure from parents. Nothing else really works. It really devastates. If it's severe enough, it devastates the child and the family, because a violent child is somebody is going to really cause havoc in the family. And right now, it's not being. There isn't funds for this. It's not that common that you could say, well, it's going to be an enormous increase in the cost of medical care. But these children should get the services they need, and because you could say, well, why not psychiatric medications? But psychiatric medications usually don't work in these kids. So, I would think the cost of a treatment, which is it's not inexpensive, but compared to the cost of an inpatient hospitalization, some of these kids that need it, I think it's much more cost effective. That insurance companies are finally maybe now seeing that they ought to cover this.
When you see a child, how long does it take for the parent to notice improvements?
Depends again on what it is, but sometimes there have been children that a dose, just like you would see with a fever, which resembles very much, is that a couple of doses of ibuprofen or a couple of doses of the appropriate antibiotics, and they're much better. So it can be a day or two, and they resolve. And there are other kids that require, depending again on the source, that may require longer courses. But the treatment rate, if it is this condition, is pretty. The success of treatment is very high.
That's very encouraging. If people have any questions, how do they get in touch with you?
Well, they can contact our office at, I can give a number,
sure.
201-236-3876. We're located in Ramsey, New Jersey, right over the Tappan Zee Bridge near Suffern, New York. That is,
right, Matt. Matt talks very highly of you. Are there a lot of doctors in the Westchester area also who treat this, or is this a very specialized?
No, it's still doctors know about it, but I happen to have I've been doing this since 2009 full time, so I have an experience of something like 5,000 patients. So doctors will know about this, and I'm so happy. We've had a few recent patients from Westchester. I'm so happy to see that doctors have started doing the appropriate blood tests that are needed to diagnose this, and I think it's coming a long way compared to where it was.
Great.
I should mention, just in terms of Westchester, I guess.
Yeah.
I'm sorry.
Okay, would you be able to stay on, because we'll be back in like 3 minutes?
No problem. Thank you.
Thank you. Great. I'm Paul Feiner, and we're taking a break.
WVOX, America's great community station.
1460 WVOX.
Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, Greenburgh Town Supervisor, and we are talking with Matt Marzella about PANDAS. It's a behavioral it's a problem, that an autoimmune problem that many children have, that is often misdiagnosed, and we have a doctor. Are you still on the line?
Yes, I am, sir. Yeah.
So we were talking about, the problems and some of your thoughts on it. Do you want to continue?
I just wanted to mention that there are some very excellent resources for OCD itself in Westchester. For example, the hospital, the Westchester, the Cornell Westchester Psychiatric Hospital, which is near the Galleria Mall in that area there, White Plains. That has traditionally been a hospital that has treated childhood OCD since the past 30, 40 years. And there are treatments besides the ones we mentioned, more behavioral treatments for some of these things, such as obsessive-compulsive disorder, that have been, tried and true as well. So I just think parents don't have to necessarily rush to psychiatric medicines and should really have their children evaluated for this condition if there has been a sudden uncharacteristic change in behavior that's not otherwise explained.
And it seems like this is relatively easy to treat OCD issues.
Not always. It can be one of the harder. It's actually, studies have shown it's harder to treat than depression. The medications that, are available for it and the therapies for it are relatively hard. Sometimes if it's a specific phobia, like the child can say, I'm afraid of a dog or something, well, there's another thing called exposure therapy that they can do, which is kind of like starting off with small dogs and then building your way up to German Shepherds and things. So those type of things are available. But OCD can be a challenging thing to treat because you feel that the thought is real and the thing, and you don't. A lot of times, smaller children can't even tell you why they're doing something. So
Yes.
they have an obsession or a thought, but not a or they have a compulsion or they do something, but they don't know why they did it.
Well, I also think a lot of parents, they always think of OCD as like a hand-washing thing or like an order thing, but it could manifest in other ways, such as them being afraid to say certain words or touch certain things or even use a fork or a spoon for fear that it might have touched uncooked food or something.
Sorry.
It's very hard to tell in the very small child, 3-4-year-old, as you could imagine. Their behaviors are a little bit like that they have rituals and they're very rigid in the way they do things and like things in a certain order. Really, above 4, it's, it gets more and more unusual to see these behaviors in older kids.
Matt was saying that he noticed with his child, dairy products usually create problems, or gluten.
Like an inflammation increase.
Yeah, absolutely. I mean, once again, it's maybe specific to a certain child. We certainly test for it as part of that. It doesn't work in everybody, but there are definitely certain children that where the dietary change is dramatically effective. So it's not always necessarily an infection. It's more the overall inflammation there. But it is we know precisely what, the things that trigger it, and we know how to precisely treat them. So it's not just like general type of treatment that's often offered for patients with autism, for example. It's much more
every child's
specific.
Treated specifically to their
That's right. That's right. There's no protocol really that you
So
can
it's
say.
really right. So for this type of issue, it's not everybody's different and everybody's unique.
Everyone.
That's right, and genetics plays a role in it too. And we try to do is stabilize the child and prevent. It's impossible to avoid all infections. I mean, we're constantly being exposed to viruses and bacteria by just living on the planet. So, short of living in a bubble, there's nothing else you can do. So, we may have to put children on protective antibiotics at times, but we base that on their immune system, which we look at carefully in this condition.
Is the symptoms of this after they start treatment, are they permanent, or is as long as you basically treat it, it'll go away at some point?
Almost always, it goes away. In many patients, if not right away, it will go away after puberty. So it might take a period of time. But there aren't too many people that go on to adulthood with the same type of symptoms.
What if
there may
not?
be adults that had this as a child and may have some features of it, but for the most part, it definitely gets better.
And if they're not if they don't find proper treatment and they're not being treated at all, and this just continues, do you think there could be permanent damage there?
I'm not sure about permanent damage to the brain, but it definitely gets harder and harder to treat, and you may have to use at some point immunosuppressive therapy, which would mean steroids, something called IVIG, intravenous gamma globulin. But so far, there isn't convincing evidence that it actually damages your brain like an autoimmune condition such as multiple sclerosis, where there's actually scars on the brain. Mm-hmm. It isn't that way, but it certainly can, one thing, if it's severe, it robs your childhood. That's what it really does, and that's an awful thing,
Great. I really appreciate it. Could you tell us again how people could get in touch with you?
Sure. The best way would be through a phone number, which is 201-236-3876.
And Matt, how long have you been using this doctor, and how does he compare with the other doctors you've used?
Since December 2016, Dr. Trifoletti, he knows what he's talking about. He listened to us when other doctors wouldn't, and he didn't just listen, but he ran tests that were necessary where other doctors told us there was nothing to do. There was no test to run. We don't need to run anything at this time, and I think he's trying to get to look at the big picture instead of treating every child the same, which I think that's what's happening when we just go to the pediatrician. Every child's treated the same, but I think we have to start looking at every child is different.
So you must be like one of the fathers of the year, because it's really very commendable that you never gave up. So you kept going to different doctors, trying to find a cure, and eventually you found something that works.
Definitely, yeah. I mean, just when you see your kids that way, it's horrible, and I don't want anyone else to have to go through that. So that's why we're trying to raise awareness.
Great.
Yeah.
Thank
and
you.
his wife, I should mention his wife, too.
Yes, definitely.
I know
Not
it's
just me.
Father's Day, but his wife is wonderful, too.
So it could be mothers and fathers.
She started us on this path. She did a lot of the initial research, but we're a team. You can't do this alone. You need a good structure at home, and I couldn't do it without her.
That is that is great, and I guess for one of the big problems is that a lot of people do a lot of parents give up. Do you think, or just
I don't think
not doing enough?
I don't think they know what to do or where to start because they're just following the pediatrician.
Right.
I could say it's probably a little bit better now than previously. A lot of it has to do with the ability of people to network on Facebook and other places. There's a lot of information, and this is true of a lot of different diseases. If you have a child with, or you feel that maybe what the doctor said to you doesn't feel right with you, you can often, use those resources, and you can find other people that are going through what you went through, and that often will lead you to the right doctors or other ideas about what might be wrong, So that's definitely rapidly increasing, as you know.
That is really great. I really appreciate you taking the time to be with us today. I learned a lot from this program, and I wish you great luck and success in helping other children and parents, because I think it's really important that a cure be found. And Matt, I want to thank you for your efforts. You're involved with the support group.
Thank you.
And what's the name of the group?
I'm not really. That's just the family groups online on the Facebook groups. And
how do they get in touch with you?
We're on the New York, Connecticut PANDAS parents group. They could look that up on Facebook. A lot of us are on there.
Great. Thanks a lot. I'm Paul Feiner, Greenburgh Town Supervisor. I'll see everybody next week. Thank you.